everyone, so in today's video I want to talk about the things that Medicare doesn't cover in general. I already did a video about dental, vision, and final expenses. So another thing that many people who are transitioning onto Medicare kind of require is long-term care, because Medicare does have a nursing home and a home health care benefit, but it's a medical benefit. So medical benefit meaning that it's an acute treatment that is pretty much saying that you are in this predicament right now due to an injury or an illness, and the illness is going to get better. It's not like your perpetual state. So what that basically looks like for people who are on Medicare using that skilled nursing home benefit is they are supposed to be getting better, or their symptoms are supposed to be improving, meaning that they're going to eventually get out. If this is not their status quo anymore, they are moving from being unable to kind of move around by themselves to being able to move around by themselves again. So many people kind of find that very I guess not misleading, but just kind of hard to swallow, especially when you're in that situation when you kind of need long-term care. You need custodial care or convalescent care, as it's known as by other names. Another thing that Medicare doesn't cover is hearing aids. So they cover, like, I guess you could say ear-related injury, ear-related illnesses like ear infections, but they don't really treat you, or they don't really provide coverage for hearing aids. Now that may change depending on whether or not the legislation passes. I know they're trying to add hearing aid coverage for seniors because that's one of the gaping holes, just like vision and dental. But that may or may not happen, and as of right now, as the recording of this video, 2022, hearing is also something that's not covered by Medicare. Another thing that is also kind of misleading is if you do buy a Medicare supplement plan, or you do buy a Medicare Advantage only plan, MA only plan that does not include prescription drugs actually aren't covered by the original Medicare program. You have to sign up for a separate Medicare Part D program, which has its own kind of governance on when you can sign up, whether or not you may have a penalty, and their coverage kind of structure, the deductible, the co-insurance, donut hole, and then the catastrophic phase. So that's another thing that the original Medicare program doesn't really cover. I mean, original Medicare does cover medications given in the hospital and in the physician's office, but anything you pick up from like the pharmacy, that's also not covered. Interestingly, something that Medicare is, I believe, working on to get coverage is the COVID-19 take-home test. For many of the Affordable Care Act plans and employer plans, they have actually expanded coverage to the COVID-19 take-home test, which you can pick up at a pharmacy. But for Medicare, because of the way that Medicare handles their pharmacy program, or anything picked up from the pharmacy, you're actually unable to get the COVID-19 take-home test at no cost currently, as of this video recording, February 2nd, 2022. So that's another thing that you cannot get on the original Medicare program. Also, something that a lot of people think that you can get on Medicare, in addition to kind of like the long-term care, is really good cancer coverage. So if you are not on a Medicare supplement plan, and you just have a Part D plan, then one of the kind of sneaky costs of Medicare and mostly Medicare Advantage plans is the cost of cancer chemotherapy. Chemotherapy sessions on Medicare Part B are billed at 20%. So I don't know how much actually it could cost, but it could cost quite a bit of money if you're looking at chemotherapy 2 to 3 times a week, and that 20% can add up. And for Medicare Advantage plans, a lot of times the chemotherapy benefit is that same as Medicare Part B, 20% coinsurance. In addition to that, if you do have any take-home medications that you have to pick up from the pharmacy, those costs have been going up, and annualized or an annual cost of one of the more expensive cancer medications can run you $14,000-$15,000 probably per year, and that's having full Medicare Part D coverage, meaning you have probably the best one. And the reason why it's still so expensive is the raw cost of the medication is, $100,000 for that entire treatment session. So it can be very costly. Now, for those two that I haven't covered already, long-term care and the Medicare Part D problem, I like to call it. What you can do is you can purchase different types of long-term care insurance, or, and this is what I always tell people, you just need to have enough money to cover the need, or at least kind of figure out what you're going to do if the need arises, because the last thing you want to do is have no idea what your options are when that time comes. At least have a plan. And, for cancer, same thing. Here's your exposures, have a plan. Now, for insurance options, there are, quite a large amount. So in the next video, I'll talk about long-term care, the different types of long-term care insurance you can pick up, and then of course the cancer policies